Statistics provided by Bupa show that between 1 and 2 in 10 people in the UK suffer with IBS. You can develop it from any age, but symptoms most commonly start between the ages of 20 and 30. Dr. Dawn deliberately chose to focus on IBS within the Channel 5 documentary as she states, they usually impact working-age people. Whilst they are not fatal, they can have a massive impact on quality of life and productivity in the workplace. Dr. Dawn is on a mission to find people whose lives have been utterly decimated by these conditions in order to see if she can find ways in which they can learn to live with them or even to stop symptoms once and for all. Within the program she spends time with Gemma, Alicia and Grant, 3 severe IBS sufferers, who, as Dr. Dawn told Express.co.uk, are young, sassy, with it people who should be living life to the full, are being affected both socially and professionally by the condition. As well as trying to help IBS sufferers, Dr. Dawn is hoping to conduct some slight investigational work by meeting people who are doing fascinating research and potentially working on groundbreaking tests and treatments that could potentially revolutionize the way we manage these conclusions. By investigating this, she is hoping to open up the conversation and destigmatize conditions such as IBS, which some people find embarrassing to talk about. Dementia diet: 3 foods to remove from your diet to help halt-risk IBS stands for irritable bowel syndrome and is a common condition that affects the digestive system. According to the NHS, it is usually a lifelong problem and can be extremely irritating to live with and can have a big impact on your everyday life. There is currently no cure. The main symptoms of IBS include the following: stomach pain or cramps, usually worse after eating and better after doing a poo. Bloating, your tummy may feel uncomfortably full and swollen. Diarrhea, you may have watery poo and sometimes need to poo suddenly. Constipation, you may strain when pooing and feel like you cannot empty your bowels fully. Other symptoms that individuals may experience is increased flatulence, tiredness and a lack of energy, feeling sick, backache and problems with peeing. Fatty liver disease, expert shares 4 lesser-known symptoms, insight how to live longer, lifestyle decisions that predict successful aging, tips. I'm worried it's cancer. Julie Walters thought doctors made a mistake with diagnosis. Latest, common treatments after receiving a diagnosis of IBS include dietary management. A dietitian may suggest an exclusion diet which will exclude a number of common trigger foods. A common form of this is the low FODMAP diet. According to Guts UK, this specific diet, which involves cutting out a specific group of carbs that are notorious for triggering bloating, gas and stomach pain. Specific foods such as milk, figs, garlic, onions, blackberries and lychee are all sources of the 4 groups of FODMAPs. Alternatively, individuals can use medication to reduce bowel spasms. Most of these are available without prescription and advice can be gained from a pharmacist. Dr. Dawn goes one step beyond these common treatments, looking at lifestyle changes instead. Dr. Dawn added, it's about getting people talking about the condition, about encouraging people to come forward and seek help, but also a really positive look to the future about what else we can do and other ways of managing, so it is not all about medical stuff. It's not all pills and potions and injections. There are various different things that some patients have found life-changing. These unusual therapies include yoga and hypnotherapy. Although it is still not known if therapies or exercise such as yoga is an effective form of treatment, Doing the aerobic exercises can reduce your stress levels, meaning your intestines won't be as disturbed as much as they would from more physically demanding forms of exercise. In addition, it is believed that certain poses can help relieve symptoms such as gas and bloating. If you do start to experience symptoms of IBS, it is crucial to visit your GP and ask for advice. Dr. Dawn reiterated this point, saying, "Try not to use Dr. Google, as he will usually give you something incredibly serious. Do come and have a conversation with us. I know it is incredibly frustrating sometimes to wait, but I am a huge believer in using that time positively. I would say if you've got to wait for an appointment, spend some time quietly, sit down, have a think about when your symptoms started, what makes them better or worse, what you've already tried and what you are worried about. There is always something we can do to make it better." How to Stop Your IBS with Dr. Dawn Harper airs Thursday, September 16, 7 p.m. on Channel 5.